For my bioethics topic, I chose Should Vaccines Be Mandatory in the Public Health System? Introduction to Public Health and Vaccines. Public health focuses on protecting the health of an entire population, not one sole person. Vaccines are a critical role in this by preventing the spread of infectious diseases, which can reduce the morbidity and mortality rates and promote community immunity. The importance of vaccination in public health. Vaccination can reduce disease outbreaks. They can significantly contribute to the decline and prevention of infectious disease outbreaks, which can lead to improved community health outcomes. When the vaccination rates are high, the incidence of disease such as measles and polio is drastically reduced, which protects the population as a whole. Vaccinations can also protect vulnerable populations. Vulnerable populations could include infants, elderly people, and those who have compromised immune systems. By ensuring high vaccination coverage, communities can shield these at-risk groups from preventable diseases. Vaccinations can save healthcare costs. Vaccines are cost-effective to the public health interventions that reduce the burden on healthcare systems. By preventing diseases, they not only save lives, but also significantly lower healthcare costs associated with treating vaccine-preventable illnesses. Vaccines also promote herd immunity. Herd immunity occurs when a significant portion of the population is immunized, thereby providing a level of protection for individuals who cannot be vaccinated. Current vaccination rates and trends. Vaccination rates are crucial indicators of public health, but trends are showing a concerning rise in hesitancy. There's a 90% global vaccination rate for children. There is a 70% vaccination rate in specific regions, and a 30% increase in vaccine hesitancy over the past few years. The pros/arguments for mandatory vaccination are: they protect the community health benefits, reduce disease transmission rates, promote economic stability, and support vulnerable populations protection. The arguments against mandatory vaccination and/or the cons: personal autonomy concerns, vaccine safety apprehensions, religious belief conflicts, and philosophical objections raised. Public opinion on mandatory vaccinations. The diverse perspectives surrounding the mandatory vaccination can inform public health policies. Support for mandatory vaccination. A significant portion of the population believes that mandatory vaccination is essential for the public health. Opinions on mandatory vaccines are very significantly across different demographic groups, which are influenced by factors such as age, education, and geographical location. The rise of vaccine hesitancy. An increasing number of individuals express skepticism towards vaccines, which is leading to a growth of an anti-vaccine movement that challenges public health initiatives. Ethical considerations in vaccination policies. Public health benefits of mandatory vaccination. Mandatory vaccination can greatly enhance public health outcomes by significantly reducing the spread of infectious diseases. The policies can create herd immunity, protect those who cannot be vaccinated due to medical reasons, but however, the collective responsibility to maintain public health can outweigh individual preferences and also contributes to a safer community overall. Concerns about individual rights. On the other hand, mandatory vaccinations raise serious ethical concerns regarding individual rights and autonomy. People feel that such policies infringe on their personal freedoms, including the right to make decisions about their own bodies. Additionally, there are concerns about informed consent and the potential for discriminating against those who refuse vaccines for valid reasons, such as health issues or deeply held beliefs. My personal view of vaccines being mandatory is I feel that vaccines should be mandatory in infants and children because of the rise of communicable diseases such as measles and polio. For adults, I believe it should be their own choice for what is going in their body. The artificial intelligence view. I used Microsoft Copilot and I asked, how does AI view if vaccines should be mandatory in the public health system? And the response I received was AI doesn't hold opinions the way humans do, but it can analyze the issue from multiple perspectives by weighing evidence, ethical principles, and public health outcomes. And then it showed how an AI lens might frame the debate, and it gave public health perspective, ethical perspective, social perspective, and then it gave a mandatory and non-mandatory view for each of those topics. And then AI's neutral synthesis, and it says AI would likely conclude that the best approach depends on context. And high risk, it gives an example for high risk scenarios and then stable low risk environments. And then the final thing it said was, so AI doesn't choose sides, but it highlights the trade-off collective safety versus individual freedom. The optimal path often blends both, targeted mandates in critical settings paired with strong education and trust building elsewhere. Thank you for looking at my project.